Thank you. Anybody here from California? I'm loving you a lot. So listen. They're coming after Medicare, and we say, no way, no way. What do we say?
No way!
I think they need to hear it all the way over there. Eric Cantor needs to hear it.
No way!
That was good. I'm so very happy to join you today again. I was here recently for another wonderful rally because it gives me a chance to thank all of you, not only for helping me to keep my work so I can fight for those patients that you serve, but also for what you do on the front lines every single day. You're there for all of us when we need you, when we're in pain, when we're in need. You show your dedication and your compassion. You show your heart every single day. Too often, the work that you do is between you and your patient, and it may be overlooked. Too often, your concerns may not be addressed. And too often, far too often, nurses are overworked because of staffing levels that are simply inadequate. And I'm here to tell you that is unacceptable. It is unacceptable. That's why I'm so excited to work with you again to reintroduce the National Nursing Shortage Reform and Patient Advocacy Act. This bill protects the rights of nurses, first of all, to speak out for your patients, to speak out for yourselves, without the fear of retaliation, because if there's a problem at your hospital, you should be able to talk about it. That's the way we make things better in America. Not by silence, by honest talk. And this bill sets a minimum nurse-to-patient ratio, because patients are not going to get the care they need if you have too many to take care of. And 12 years ago, nurses in California fought and won a major battle for their patients and for themselves, and they won minimum nurse-to-patient ratios. And we now have proof, scientific proof, that it is working. And I love nurses. You're not afraid of anything. You weren't even afraid of the Terminator. He terminated himself. Research found that if other states adopted the same minimum standards, they could decrease surgical deaths in hospitals by more than 10%. So this bill is a lifesaver. We can say our bill to reduce those ratios is a lifesaver. Studies show that our patients in California are more satisfied. They feel the quality of their care is better when nursing staffing is better. Let's face it, the patients don't see the doctors all that often. It's in, it's out. It's the nurses that carry out the needs of the patient. It's the nurses that are there when they cry in pain. It's the nurses that respond to their families. So I'm committed to bringing those ratios to the rest of the nation. And if people will listen, they'll see what a win-win-win this really is. So I'm going to enlist you not only on this bill, but that fight to save Medicare and Medicaid. Because I'll tell you, my mother always said, all of our mothers always said, without your health, you don't have a thing. And I don't care if you're a poor person in the street or the richest billionaire in the corporate suite. If you don't have your health, you don't have anything. And you're the ones who bring people their health back. You're the ones who ease the pain when we need you. So you know better than anyone, when we say Medicare has to stay, when we say Medicaid has to remain, you know what happens in nursing homes if we cut Medicaid. What's going to happen to the most vulnerable, just fragile people in our society? Terrible, terrible things will happen. Somebody said they'll die. They will die, but they'll suffer. They'll suffer badly, and they'll leave this world thinking no one cared about them. Well, we're here to say this. We're sending a message to the families of America. The nurses care about you. There are members of the Senate and Congress who care about you, and we're going to work together. Thank you so much. Keep up your wonderful work for the people. California, thanks for sending me back.